everyone. Joanna, thanks for being here with us today. You hit unicorn status this year. Congratulations. And in the announcement, one of the first things you focused on in detail was AI. You're a women's health company, but you've prioritized that. Why was that important in your actual unicorn release?
You know, I thought I was starting a menopause company, but it turns out I'm starting an AI company. I have actually really learned that we can use AI in extraordinary ways to scale great care. So one of the questions we had when we first started the company is, how are you going to take care of millions of women and make sure they all get access to really high quality care? And I think there was rightly some skepticism there. How am I going to train thousands of providers to make sure they all follow care protocols? How do I make sure that we have standardization across the country as we scale? So it turns out that AI is magnificent for that. And what we've found is that we can use AI to train providers, to create really good care protocols, to ensure quality, plus for efficiency in a way that is making our company much more, honestly, exciting and higher quality care than I ever could have hoped before we were using AI.
So tell us how you get to that higher quality care. I think you've created your own LLM effectively.
So it's a RAG, which is retrieval augmented generation. I'm going to get those words wrong. Okay. But the point is, there's OpenAI, okay? OpenAI pulls from the whole internet. And that's a lot of old, outdated data with regard to women. So before 1992, women were not even included in clinical studies. There's also a really bad study done in 2002 that really got women's health wrong. And for 20 years, women got the wrong health information because of that. What does that mean? It means all the data in those 20 years published was wrong and misinterpreted. So if you have an open AI, if you have an open system, it pulls from those studies and gives women incorrect data. So we had to start over. And we had to create our own care protocols, and we engaged doctors from around the world to actually help us create care protocols. And then we have turned that into a system that all of our providers can go and search to make sure that they give the right care to women. So it's actually really rewarding, I have to tell you. The nurse practitioners who are providing the care are just astounded by how good providers they are now because they have access to all this data. So they're able to put in very complex cases and get really good information back on what's working for the patients, what did work, using all of our historical information as well. So we're really able to scale really good care.
And there's a lot of skepticism in the public toward AI and about hallucinations and its reliability. So tell us about working with these nurse practitioners. How did you get them to buy into it, and how have they become convinced?
Yeah, so honestly, AI transformation in a company is hard. You have a lot of work you need to do to get people to buy in. So we had an entire process where we started with, about 10 of them, and they were testing it, and it was like, can you beat the AI? Are you going to trick it? And they did find things that it wasn't doing right, report back, and then we iterated, we added 20 more, then we iterated, and then we slowly rolled it out to the whole company. And so a lot of it, when you're thinking about AI transformation in a company, a lot of it is getting people to buy in and getting them to feel comfortable and getting them to trust the technology. And it took us a while to get there, but now we have hundreds of them using it.
And what was, can you give us an example of a turning point where you changed someone's mind? You telling me how you went around the country talking to people doing this?
So that's just not with our NPs. What I've been doing is actually going around the country and having dinner with our employees, because the company is mostly remote. And I ask them, how are you using AI in your job? And often they are not, right? And then I would say, okay, so what are you working on today? And a woman said, well, I have this assignment. I have to go review 150 contracts to see whether we needed to use a translation service in certain states, let's say. And she said it was going to take her a month to review all these contracts. I said, oh, well, let's go try Gemini. And we pulled up her laptop at dinner, and I showed her how to put all the contracts into Gemini and then ask Gemini the questions. And it took her 10 minutes. And then you see her eye light up, and she's like, oh my goodness, you just made my life so much easier. And so that was, when that first happened, I was like, okay, I'm going to go have dinner with everyone around the country. So now I go have these dinners, and we host the dinners, and we sit down, and we say, okay, what are the things you're learning? And then we've also actually opened AI office hours. So we have engineers who we recruit to come and answer the questions from the non-engineering team and basically help different people on the team to AIify themselves. And I think of it a little bit like Henry Ford with an AI toolbox. Like, how do we basically go around the company, be Henry Ford, make automation, but do it in a way that people are comfortable with? And honestly, for us, they're not losing their jobs. It's not threatening. It really is about augmenting their jobs and making them easier and making their jobs, honestly, far more interesting.
And does it give you any insights into how AI might or might not be effective in healthcare in terms of truly getting the better outcomes? Because that's one thing that has been talked about a lot, but there's a little skepticism, like, when is this going to happen?
Well, I think already it's getting better outcomes. So I'm not skeptical about that. I think that if you think about going to if you go to your local primary care physician, the likelihood of them knowing every single question that you have is just really, it's hard. There's just too much data out there, and we as humans are complicated beings, right? We have a lot of questions. What supplements should I take? How much of this one food should I take? How much should I, there's so many questions. You can't expect that doctor to know it all. And then they leave and they come and the women are so frustrated. Well, my doctor didn't listen to me. Well, the doctor had 15 minutes and had to answer a lot of questions. So I just feel like the AI, when you use it appropriately and when you are able to get the right information out there, you're able to be a much, much better provider using AI. And so most of our providers just feel very empowered by the fact that they have access to this really good information.
And do you feel happy where you are? I think you mentioned you wish you'd done it even sooner. What's the time? How are you feeling where you are in terms of your path on this?
I mean, I suppose the challenge is the technology is changing so fast. So every few months we have to look and say, are we up to date on what we're doing? And make sure that we are, and then make sure the whole company is following along. And that's a challenge. I mean, operationally, bringing AI to your entire company and getting everyone to change how they are doing things is a challenge. But the more comfortable you get the entire company with the technology, the more they're willing to explore and use it with you. I mean, I'll tell you, this morning I got to work early, and the head of my billing department was there. And I was like, Chris, how are you doing with AI today? And his eyes lit up. And he was so excited to spend the next 20 minutes telling me about the different software that he was implementing and that he was making his own code. I mean, and I said, you didn't really expect, even a year ago you'd be doing this, and he didn't. So it's actually really fun when you see that someone kind of wakes up and realizes all the things they can actually do, even when they're not an engineer.
That whole vibe coding phenomenon, and we'll see what it means for the software companies. So some of your investors are very famous celebrities, Amy Schumer, Connie Britton, Tory Burch, and was that intentional? Do you think that's an important part of your message to have some pretty impressive investors, well known?
Have you noticed that the media likes to write about celebrities?
There you go. So that was intentional, yeah.
The media really likes to write about celebrities. It's just crazy. I mean, I also have some really impressive funds as investors, but everyone wants to talk about the angel investors who put in, who are celebrities, who put in money. It's just true that people like to talk about celebrities, so it's a good strategy to have them invest in your company because people pay more attention to it. The other thing that I've found is that, honestly, people often trust influencers online far more than they trust doctors. And so micro influencers maybe have 10, 15,000 followers sometimes, and their followers will absolutely trust them more than they will trust their physician. And so we are, we have to only work with credible Instagram celebrities or Instagram names, but people really do trust celebrities, and so getting them on board has actually been a very successful strategy for us.
So that's part of what you do, is go out and find brand ambassadors for you online.
We do.
Yeah.
As long as they follow, they have to really follow our care protocols. We're very choosy about who we work with. But yes, we do find that actually working with Instagram influencers and celebrities is a really good strategy to get your name out.
There you go. So, excuse me. Another very interesting thing in terms of investors and fundraising, you've mentioned you got a lot of no's. I mean, you're a unicorn and you've raised a lot of money, but you got a lot of no's along the way. So How do you process something like that, and what do you do with that information?
I think the best thing I learned is that no's are actually only not now. And I know it's a pat thing, but it really is true. And it is certainly true in fundraising. So there were a number of people who I approached early on. Honestly, menopause has become a really hot word, right? But a few years ago, menopause was not hot. And it felt hot to me, but it was not hot for everyone else that I was talking to. And I was having a really hard time getting people to pay attention to me. And I would go and I would give them the argument and explain to them why this should matter to them, and they would turn me down.
But by the way, you already had a successful exit. I mean, you had like all these connections.
It was still really hard to convince people this was a market. I mean, women's health has exploded recently, but it was not a market a few years ago. I can't.
You explained once that the VC needs to see a potential, $10 billion potential, right?
Yeah, they have to really believe it can be a big company, and explaining to them why it could be a big company is hard. So many people say no. They're just always going to say no. And I just decided that I would just stay in touch with them after they say no and send them updates and go on walks with them and just stay friends and keep going. And honestly, some of the firms that turned me down 2 or 3 times ended up investing later. So it was definitely the case. I mean, some of them still said no forever, but a lot of the ones that I really stayed friends with I was able to bring them along to a yes eventually.
And the no's, what did you do with the information? I think you talked it over with your team. Can you talk a little about that?
I used to take notes. Now I would do it on AI, but before I had to write it or type it. But I used to just go back and tell everyone, here's what they said. Here's what they didn't like. Here's what they liked. Here's what the feedback was. Do we like this feedback? Do we think it's relevant? Let's take what we can from it and ignore the rest. But honestly, a lot of them were pretty smart in their feedback, and so I thought it was helpful to share. That's
great. I'm going to go to questions in a minute if anyone has any. But you've had a long career before you got to this job, to this role, which you started 5 years ago. And yet, we see Karina, there's people are dropping out of college, high school to start companies. So do you have a view no, it's better to wait? I mean, you had so much experience and connections, or do you feel like now's a good time in your life to be running a company? Can you give us a sense of the whole age and founder thing?
Well, I saw her and I was like, wow, I did not have that level of confidence in myself when I was 24.
Right? Yeah.
So I have a lot of admiration for that. I think it really depends on where you are in your life. For me, I'm so lucky my kids are gone. That is the best. I have so much time. I can't get over how much time I have. And honestly, I have more energy. I have time. I don't have to cook dinner for anyone. I don't even have to think about cooking dinner for anyone. So for me, starting a company now my kids are gone is really great. But obviously for everyone, it's whenever I think it's the right time for them in their own life. But I feel really incredibly lucky that I get to do this in the second half of my life. So I just feel very fortunate.
That's great. And you probably have some great healthcare. Are there any questions in the room? Anybody? You may just let us know who you are, and I think I know who you are.
This is Alistair from Business Insider.
Great.
You have an AI-powered product, and I wondered whether you worry about being a kind of AI wrapper. So the idea, you mentioned OpenAI, and it answers health questions, and then there's open evidence, and then Google answers health questions. Do you feel like there's a sustainable place for vertical specialists in this area?
So we at Midi are insurance-covered care. I don't see a world anytime soon where insurance-covered care is provided by AI. And I also think that despite a few unique things happening, that most care, most prescribing will be done by providers. Although one state is doing a test around this, in general, doctors and the state medical institutions are not so fast to let AI do prescribing. So What I feel really good about is we're able to offer insurance-covered care in all 50 states. I would love you to come eventually, search my AI, do all the research before you come to the provider, and then say, okay, clinician, do you agree with this AI? Is this the right thing? And we can discuss what I just learned from my AI search, and then together you'll decide whether that's the right approach to your care. But I don't think that doctors and clinicians are going to be replaced. I just think it's very much around augmentation.
Because what you're describing is probably happening. I think most of us go to AI first now, right?
That's exactly right. And the problem is if you go to the open AI, then people come to us a lot with the wrong information. So we spend a lot of time debunking the things they saw in AI because it doesn't include only the most updated women's health research. So I'm hoping over time we'll actually be able to, our AI will be good enough that we can expose it to the public, and then people can search it themselves before their visit.
Oh, you're specific.
Yeah.
Yeah. Okay.
Right. So what I'd like to do is create my own vertical AI for women's health, and then open that to other people. We're not there yet, but that's certainly a goal that we have.
And there's one question in the back here. Just let us know who you are.
Hi, Sumit from Crafting. You mentioned that you want to make it more vertical, but the way AI agents are integrating with each other is evolving so rapidly, and we're also seeing people interact with it in new and novel ways on a pretty regular basis. How do you think the average user of Midi might actually change how they interact with AI over the next year, whether it's a nurse practitioner, a patient, or somebody else, maybe 6 to 12 months from now?
Honestly, I'm making a bet on the fact that people still want to talk to someone for their care. Other companies are probably going to make a different bet, but we have found that what we are going to be really good at is empathy, and that empathetic person who understands you, who asks you a bunch of questions and really gets to know you, and then we're offering longitudinal care over a long period of time with the same provider, so it's not just episodic care. I still believe people want that. So from my vantage point, I'm going to use AI to make the care better, to make the tools better for efficiency purposes, and to ensure high quality, but the bet I'm still making is on the human interaction. And so I don't see that going away. I mean, it's a joke at our company that when we first started, people would come in every day and say, thank you for the care, but what they said was, I felt seen and heard and cared for. And our engineers used to read this every day, and they're like, wait, are we a medical company? Like, why is it that people are thanking us so much for feeling seen and heard and cared for? And I think that's still what people want. So that is certainly the bet that we're making.
Isn't that answer yes, you are? When your engineers asked you that?
Well, that's why I said, so when they ask that, I'm saying, yes, we're doing the medical care, and what people are really missing is actually the emotional connection of someone who cares about them, and that's what we're doing. And that's what we get thanked for more than everyone else.
Oh, just
it's the emotional connection.
Yeah.
I don't think that's going away. We don't have a sense that people really want to get their care from AI. We get the sense they want to do research, and then they want to talk to someone about their research. But I don't know, so far, our business is not suffering from people doing a lot of AI searches.
Emotional connection. A very close friend of yours, Susan Wojcicki, passed away a couple of years ago. One of the great leaders of Silicon Valley, YouTube. How does her legacy play a role in your leadership now?
So yes, it's true. Susan was my oldest friend, and we were friends since we were 10. And I had the opportunity to watch Google get started in her house, and I used to go over there all the time. But to me, she was just a normal person. Like, she wasn't a luminary, and it's actually incredibly helpful in your life to see normal people do great things. I find that, for me, it's very inspiring. And then, so watching her grow to build this huge company and still be a very normal human being is actually both reassuring to me, but also it shows that you don't have to be a super person to do these things. You just have to actually be brave and decide to go do it.
Thank you so much. Great to have you, Joanna.
Thank you.
Thank you.